Hey, Dr. Alan Christianson here, and I want to talk about important supplements for you if you've got Hashimotos. And two perspectives on this, one of which is you want to make sure you're getting what you need, but you also want to make sure that you aren't getting what you don't need, things that work against you and things that set you back. And then the other part of it too is you don't want to get things that are just not critical. You know, there's a whole lot of things that are not bad per se, but are not the most important. And supplements are all cleared by your liver. Your body metabolizes all these. And sometimes taking 30 things that may be of a little benefit is actually hard on your system. So you want to really laser in, figure out what you need and not go past that. So let's give a rundown on what to think about in terms of just day-to-day supplementation. So vitamin A, starting at the top. The main thing to think about is getting a good blend of carotenoids. You know, beta-carotene is the one you hear about the most. And your body makes that into active vitamin A. But you want to blend. There's many other carotenoids found in whole foods, and better versions of vitamin A contain a mixture of that. I actually love palm fruit as a source because that's got a nice spectrum of carotenoids and also very bioavailable, easy for the body to convert and activate. So we'll come to the B vitamins in a bit because they're all different, but vitamin C next up. This is a good thing to get. You don't really want a ton of it. There's been more data saying that antioxidants, they're important to have, but if you get too much of any one, you take away from your body's own antioxidants. Things like superoxide dismutase or glutathione, they become weakened if you do too much of any one isolated antioxidant. I love getting 1,500 milligrams of vitamin C, but really not much more than that. It gets to be counterproductive at some point. So vitamin D, this is a big one, and you hear a lot about liquids and sublinguals and drops. You just got to take enough, and you've got to take it with food. So I actually like capsules because it's easier to know how much you're getting. Sometimes the droppers are hard to measure accurately, but you need to take enough. Very few people get to a good blood level on less than 10,000 units of vitamin D per day, so super critical. Once vitamin D is in your body, then we've got to think about the whole calcium discussion, because vitamin D allows you to absorb calcium. And that's good and bad. The good part is if it's the right type and you're using it properly, you get stronger bones. It's bad because if it's not the right type of calcium, or if your body's not using it well, it's going to make plaque. It's going to make plaque in the blood vessels. You know, we see things like joint calcification or kidney stones or gallstones. That's all calcium gone badly. So the main types of calcium that are important are the ones that are like calcium found in plants. They dissolve really easily in water. My favorite is one called dicalcium malate. That's a type that doesn't really have issues with calcifying, so it can't glom up your arteries. It's also nice because it's clean and free of lead. So a lot of calcium is derived from oyster shells or from bones, like the microcrystalline hydroxyapatite, the bone-derived calciums. Even we're concerned about bone broths and collagen and gelatin because bone tissue always has lead in it. So you want clean calcium that's more so from plants, and dicalcium malate's my favorite by far. A lot of the same things go for magnesium. And then we think about how much. You know, a lot of the guidelines about quantities for calcium magnesium were based upon types that were very badly absorbed. So you had to take mega doses because you weren't absorbing much of them. I'm a fan of just a couple hundred milligrams or even slightly less, and also more equal ratios. When they are the types that are from plants and well absorbed and not full of lead, you don't need much, and too much is actually counterproductive in all things. So what else do you want to think? Well, there's the B vitamins, and they're all critical. One of the big things is folic acid. So you want folate, you want methylfolate especially, but you want to avoid synthetic folic acid. With thyroid disease, there's a gene defect that makes folic acid poison. So literally, folic acid raises the risk of colorectal cancer for those whose genes can give them thyroid disease. So you want to avoid it completely, just none of it. Methylfolate's excellent. You really just need 1 milligram per day. which is roughly 1,000 micrograms. Well, no, not roughly, it's exactly, it's just different units. But you don't need mega doses of it. Too much is counterproductive. So 1,000 micrograms or 1 milligram is really an ideal amount. That helps your body with its methylation pathways. With it, you want some B12, and methyl B12 is a preferred form. That's one that does absorb orally. You can take a pill of it and get a decent amount in your bloodstream. No big negative issues with that. Another big hitter is biotin, and critical thing we all know about for hair, skin, and nails. You want 3,000 micrograms of biotin. A little bit more is okay, but you don't want more than about 500 micrograms because it actually blocks the usage of biotin when you get too much of it. You know, I see many that take mega doses hoping that it will help their hair, and it does not. When you get too much, it hurts the hair. It's counterproductive. So a good amount of biotin, but not too much of it. B6 is important. That one is pretty commonly available. Pyridoxine hydrochloride, pyridoxal 5-phosphate, they're both good forms of that. Thiamin's critical as well. And there's been more data about that being of benefit for the antibodies of Hashimoto's and also the hormone conversion. Pantothenic acid, pantothenate, good to have in a few milligrams for benefiting your cortisol levels and cortisol conversion. So next up, vitamin K. This is one that also helps make calcium behave. And you really want vitamin K2. There's one called MK7 that's had the most research. That's like the vitamin K that we make in our intestinal tract. And that allows us to really take calcium and direct it to the bones and away from the blood vessels. It's also important for the blood to clot properly, you know, not too fast, not too slow. So K2 is a really good thing to have. A few more fun ingredients that are important. I'm a fan of trace minerals. There's so much importance to many of these ultra trace minerals and trace minerals. With thyroid disease, selenium is the big hitter. And selenium is difficult to absorb, and there's still debates about how well selenium enters the bloodstream from supplements. So there's been the most data on selenium glycinate complexes. That's selenium bound up with a carrier protein called glycine. That one is easy to absorb, no big toxicity issues, very effective. You also want to get a few more exotic ones. Vanadium, molybdenum, boron, manganese, all critical for building and utilizing thyroid hormones. A few other things rounded out. I like some of the important bioflavonoids, hesperetin, quercetin. They do a really good job at connective tissues. So that's also big for getting your hair healthy, you know, hair, skin, and nails. Some people are prone to varicose veins or prone to hemorrhoids. And those are because of the strength of the connective tissues, you know, also easy bruising. So nice to get on a regular basis, and a few milligrams is helpful to round out supplementation. Last thing would be a couple of essential fats. And we need EPA and DHA. Those are ones that are critical to control inflammation, keep the brain functioning well, and help the body repair joints and cartilage. So that pretty well rounds it out. What do you leave out? Honestly, all the rest. And the big thing to leave out would be iodine. You know, with thyroid disease, being on thyroid treatment, you're getting a lot of iodine in it. And amounts above that would be found in supplements actually block the effects of your thyroid. You might have heard about when we had the tragic Fukushima disaster in Japan, how people were told to take potassium iodide. So here's why. When you take a high dose of iodine like that, it shuts off your thyroid. So if you were exposed to radioactive iodine, it wouldn't go in your thyroid. So it shuts it off for about 2-3 weeks. And in the case of a tragedy, a disaster, sometimes that's useful. But you don't want to shut off your thyroid every day. You want it working for you day in and day out. And that's why it's better to avoid all the extra iodine. So good things to get. Make sure you're covering the bases on those. I wouldn't do a lot of things beyond that unless there was a very specific reason for it and you had a short-term plan in mind. I see so many that end up being just overwhelmed on 20, 30 pills and combinations of things, and take this here, take that there, away from food, you know, twice on Tuesdays, and it's confusing, it strains your body, it hurts the liver, it can throw off the bowel flora. So don't miss what you need, but don't get what you don't, and keep it focused and simple. So Dr. Christianson here, and take great care of yourself. We'll talk again real soon.